Betty, I'll start off by answering that and saying that the antigen tests are very accurate. If you look at the comparison between antigen tests and PCR tests, PCR tests may detect some additional cases, but generally we believe that antigen tests are detecting cases which are actually able to transmit disease, which means higher viral loads than those which may be detected by PCR tests. So we have a lot of confidence in those PCR tests. The trade-off is with the antigen test is that we get the answer in 15 minutes. So some of the things that Janet spoke about earlier, what happens between when you get tested and when you get a result, we don't have to worry about because it's almost an instant result. There is a trade-off also, though, that we process those tests, so we can't do as many as quickly as we can with PCR tests that are being sent off. But we're excited about having the antigen test in larger volumes now and look forward to utilizing them as part of our mitigation strategy.
One other thing I'd like to add is the other reason we are excited about the antigen test is this is a pilot that we are working with AISD. Our goal is to do some additional testing next week as well, doing testing for Title I schools. In addition to that, collaborating with other school districts where they may potentially need us to assist them with the antigen test. So this is definitely a game changer for us, and we are very excited about this opportunity.
Okay, the next question is from Community Impact. Will Travis County distribute both the Pfizer and Moderna vaccines if they become available around the same time, or will one be selected over the others?
I can jump in on that. We are planning to distribute either one of those vaccines as they become available, and there are 6 other candidates that are in the pipeline. And all of our vaccine partners that we've been working with have been making plans to distribute whichever vaccine becomes available, and we are planning for that as they would enter into our market.
And Betty, I'll jump in on there as well. As you may be aware, both the Pfizer and the Moderna vaccine are both messenger RNA vaccines, so they work in a very similar way. The efficacy between the two is very similar. And I want to point out that, one of the most remarkable things from the preliminary data that has been shared is that zero of those individuals who received the vaccine had a severe case of COVID-19. So not only are we talking about preventing disease spread, we're talking about, at least at this stage, completely preventing severe cases, which is the thing that we're really worried about. Obviously, there's a lot more data to be shared and collected, but these results are very promising for both of these front-runner vaccines.
We also, with the vaccine coming on board, we are very excited about the vaccine. But we also want to just remind people that we want them to stay the course and continue to watch their distance, wash their hands, and make sure they wear their mask and stay home if they're ill, and follow the guidelines that we have in place. And so those things are going to be important as we wait for the vaccine, and even after the vaccine is here, that we continue those practices.
The next question is from Estonia. Which frontline healthcare workers will be included in the first wave of COVID vaccinations here in Austin? Will it be ICU doctors, ER nurses, general practitioners? I think they're just trying to get a sense here of exactly what the layout, why am I struggling with this now? What the order would be for healthcare workers.
So I'll start by saying, this is a similar issue that we had with PPE. Who gets it first? We have a lot of people who really need to get this vaccine early. But now we're talking about prioritizing within the priority groups of healthcare workers and first responders, et cetera. I think the data that we have locally, the data nationally is very clear. The people at the absolute highest risk for COVID-19, severe illness and death are those living in nursing homes. So, I believe that we really need to focus our efforts early on, the very first vaccines, to those residents and those healthcare workers caring for individuals in those settings. Obviously, we also want to secure the rest of the healthcare infrastructure to ensure that we have personnel available. We are well aware of the fact that there's limited redundancies in personnel in our ICUs, in our hospitals, emergency rooms, and in our first responders. So those will also be high priority groups. Again, we're expecting to have a small allocation of vaccine in the December timeframe, with more coming in January and February. Our hope is that, in those first 3 months of vaccine distribution, that we will be able to hit all of those healthcare workers and those individuals living in long-term care facilities.
And I'd like to add, this is some work that our Austin Travis County Vaccine Distribution Coalition is focused on, is what are our priority populations as that finite resource of vaccine comes into our market? How do we prioritize as vaccine providers are thinking about who they would be needing to distribute vaccine to first? These are important conversations that we're having across our healthcare system to make sure that when we get that resource, that we're able to maximize that and ensure that we extend those protections as much as we can with the limited resources that we are provided.
The next question is from KUT. Has Austin Public Health reached out directly to Governor Abbott's office to ask for more flexibility to close or reduce capacity at some businesses?
Well, I think the governor's been very clear when other jurisdictions have approached the state to lower those limits. And the response has been, you need to enforce the rules that are in place now. And that's exactly what we're doing. We're increasing enforcement activities, increasing inspection activities through Austin Public Health, Environmental Health Services. And we are working with those businesses to ensure that we can increase compliance. There may be a stage, particularly if we enter stage 5, where we may want the ability to decrease capacity, occupancy of businesses to help mitigate the spread. If that happens, then we will certainly be likely to approach the governor and have that discussion.
I'd like to add that it has been really great to work for the city of Austin in this response, working with our citizens of Austin and Travis County. Because when we talk to individuals and we bring them this information every week, they really, even the business owners, they really, with pride, look at and make adjustments. Our environmental health staff, when they're doing increased inspections and working with the restaurant owners, those business managers and their staff have been so compliant at the restaurants. And so I would like to applaud them for their efforts. And so as Austin and Travis County, we have pulled together. We have been really strong. And so knowing that we may have some limitations in different efforts that we may be able to enforce, it's just really great as a city that all of us have pulled together collaboratively to work on this based on the warnings that we provide in our communications.
Our next question is from the Austin American-Statesman. The COVID-19 pandemic forced the cancellations of many big events in Austin this year. Now looking ahead to 2021, how does Dr. Escott plan to tackle recommendations regarding the possible cancellations of upcoming events this spring?
Well, I think it's important to remember that the large events were the first thing that we turned off and will probably be the last thing we turn back on. But the situation, as the vaccine becomes available, as people get the vaccine, and as we move closer towards herd immunity, that risk for large surges will start to diminish. That's why it's important that folks get the vaccine, complete their series of vaccine, because we know right now that at least these initial vaccines are going to require 2 doses. The better compliance we can get with vaccination, the more likely it is that, as we approach April, May, June, that we'll be more inclined to start approving those larger events.
Our next question starts with a quote, and it's from Governor Abbott. It says, Texas, and I'm quoting here, is already prepared structurally for the quick distribution of those vaccines once they are approved. That was apparently a comment Governor Abbott made November 26th. What details, now here's the question, can you share of the state plan and the structural preparations already made in Central Texas?
The state plan was actually released October 16th. And since that plan has been released, and even prior to that plan being released, our department has been meeting with the Department of State Health Services and working very closely with them on the plan that they have. So it's important for us, and we have been sharing that information publicly, as well as with our partners. We implemented the vaccine coalition, distribution coalition, which is an actual regional coalition. And so we have state staff that work for the Department of State Health Services that are a part of that group. And so the phases that we are aware of is information that we have shared publicly, knowing that November was more of a planning phase. December was slated to be time where there would be the first amount of vaccine would be available. And then anticipating from January to July that there would be a little bit more vaccine available, and then the rest of the year a little bit more vaccine, kind of based upon what that plan says. And so for us, we continue to have weekly meetings with the Department of State Health Services and continue that training with them. And we will, in turn, the City of Austin we will have a plan that we are going to produce and put on our website.
And I'd like to jump in just to mention more specifics about the local level planning that we have been doing. As Director Hayden mentioned, the partnerships through the Vaccine Coalition have been critical. And those have been partnerships that we've had throughout the entire response. We're building off of the lessons learned that we have gained from the point of testing that many of our healthcare partners have been working with alongside with Austin Public Health. But in addition to that, we have been in preparation for distributing a vaccine for multiple years now. And we've done exercises as recent as last month to prepare and plan for what are the logistical needs we need to put in place to roll out a vaccine, regardless of the type of vaccine that we get, that we have the pieces in place to be able to do that and be able to manage the mass quantities of folks that we'd have to bring in for those for that vaccine distribution. So we've got a lot of planning that we have put in place, playbooks that we've been able to develop, and having that information from the Centers for Disease Control and from the Department of State Health Services has been essential in informing those preparation plans, and then also this ongoing communication across all of our healthcare partners and the others that are coming online that would be critical in helping to inform how we roll out vaccine, or have been important in helping us to be able to stand up those operations when we actually get vaccine in our market. So we're ready to distribute.
I'd just like to add that, this is a very prescriptive process that both the Centers for Disease Control and the Department of State Health Services we'll be asking the locals to implement. So again, if we could hold on and stay the course until we get that vaccine into our community, we will make all the necessary adjustments and modifications to our planning so that we can deliver effectively and efficiently and safely to our community.
Our next question is from KXAN. Oh, I'm sorry, I got ahead of myself. The Daily Texan. Is Austin Public Health working with UT Austin to coordinate vaccine distribution for the UT community, or will it be handled separately?
I can jump in. UT Austin is a key part of our vaccine distribution coalition. They definitely are looking to see what is the best approach for ensuring vaccinating their student population as well as their faculty and staff. But that's part of all of our partners that are online to work with that. I think what's really important to note is we all as vaccine providers have to consider who are the priority populations that will be considered for phase 1. And noting that majority of the student population are healthy young individuals and not necessarily those most vulnerable populations that we're trying to protect with that initial allocation of vaccine. And so those are the things that we're looking at, but they're an important partner that we'll be working throughout all of the phases of the vaccine rollout. And as vaccine becomes more and more available and the student population is slated and those opportunities become available for them to get that population vaccinated, we will be working with UT to help and assist messaging to ensure that those students take advantage of the vaccine and their faculty and staff take advantage of vaccine when it's made available during the appropriate phase.
Our next question is from KXAN. Looking ahead to Christmas, do you expect your recommendation will be the same as it was for Thanksgiving, meaning don't travel and don't gather with people you don't live with?
I imagine our recommendations are going to be very similar to Thanksgiving in relation to Christmas. Unfortunately, we're seeing ongoing increases in cases and hospitalizations and deaths in the United States and across Texas. We've got a little over 3 weeks before Christmas, and it's hard to imagine that things will improve significantly enough for us to have different recommendations. As we've said before, this year it's about modifying those traditions into new traditions that can be done safely. And that is going to mean, again, for Christmas, that we gather with people within our household and that we still interact with others outside of our household, our extended family, our friends, but we do that virtually and safely.
And I'll just add that, as we said earlier, the next week or two are going to be very critical in telling about how successful we were around the Thanksgiving holidays in trying to limit disease transmission risks by staying home and gathering in your household with your immediate family that reside with you. For those who may have ventured out and participated in activities and events over the Thanksgiving holiday weekend, those cases will likely begin to emerge, I'm going to say probably starting this week or into the weekend and into next week. And so it'll be really telling for us and will feed information and data to us about what we could anticipate for the Christmas holidays as well. So I'd like to say that we finish out 2020 with a flattened curve, and I hope that's the case, rather than seeing it spike over the next few weeks.
My hope is that some individuals made new tradition for Thanksgiving. One of my colleagues sent me a Zoom Thanksgiving. And so I thought that was very creative, where they basically had their Thanksgiving dinner and they had participants, all over, in Texas, but outside of Texas as well. So our hope is that individuals have created new traditions, that they're going to share those traditions, publicly, using social media or other avenues. But our hope is that we know that this is continuing to wear on folks. We understand that there is fatigue, but we really want us to stay the course. We can all get through this together. We are in this together, and we will finish strong together.
Our next question is from the Austin Chronicle. Bexar County and San Antonio instituted a nightly curfew over Thanksgiving weekend in an effort to curb the spread of COVID-19. Do you think a similar curfew in Austin would help slow the rise in cases here in Austin?
I think San Antonio is in a different situation than Austin right now. San Antonio's cases, Bexar County's cases, are roughly double the per capita rate of Austin right now. We're seeing lots of variations in disease trend and hospitalizations around the state of Texas. In Austin, when we look at the major metropolitan counties, are in a better situation than all of them. And that's because our community has responded. Our community is engaged in those protective actions. Our community is masking and distancing and washing their hands. And if we continue those practices, we don't need to have a curfew. But our hope is that folks will continue to do that. If we reach stage 5, there may be a reason to consider a curfew at that stage, but I don't think at this stage it's necessary.
I agree with Dr. Escott. We have really, the information that we share, I cannot tell you the number of folks that, reached out to me to say, I've changed my traveling plan. I'm not going to travel for Thanksgiving, and I'm not going to travel for the Christmas holidays. And they have done things a little bit differently. And so I am really excited how Austin and Travis County does respond to us. And we're going to continue to provide as much information as we can. So our partners across the community will continue to respond in a great way.
Our next question is from Fox 7. The White House is calling on Texas to intensify mitigation efforts, including but not limited to masking and significantly limiting indoor capacity. Is there any indication we may move to tougher guidelines because of this recommendation?
Well, again, with our transition to stage 4, we recommended that businesses only open to a maximum of 50%. I think given the trends across the state, that transitioning the state back to 50% maximum occupancy would be useful. We know that the disease is more likely to spread indoors and less likely outdoors. So, our hope is that despite the fact that we can't order restaurants and other businesses to decrease their occupancy beyond the state's recommendations, that they will do so in an effort to protect this community. Again, we've seen uncontrolled and catastrophic surge in El Paso. Lubbock is seeing significant surge right now. Dallas, Fort Worth, San Antonio is surging. Houston is surging. The list goes on and on and on of places that are really struggling right now. And what we're seeing right now also is that our rural communities are suffering. Because, in many of those communities, the advice from local officials wasn't as strong as it was here in Austin and Travis County regarding masking and distancing. In some of those more rural counties, places like bars have been open, increasing the risk. So I think it's time that as a statewide community, we start to reassess that plan and make a determination if we need to further reduce the risk by reducing occupancy statewide for a little while.
We've now started second questions for the media, so we're once again back to CBS Austin. And Dr. Escott, you talked a little bit about this yesterday to Travis County commissioners, but I wanted to follow up. When do you think the 15-minute rapid antigen testing might be readily available for the general public? Or do you see it as being an easily administered alternative to current testing?
But I can say that right now we have about 6,000 of those tests. So it's not going to last us very long. But we do know that the state is receiving millions and millions of these tests. Right now, those tests are focused on our schools to ensure that we can keep our schools open safely and protect our students and our teachers. But our hope is that as the months continue, that the availability of those rapid tests will continue to increase and that we can start to transition more of our public testing to the antigen tests because of that rapid result. Again, it's, the beautiful thing about the Abbott Binax Now test, the antigen test, is that it doesn't require a machine to run it. It's sort of like a pregnancy test. You swab the nose, you stick it in the card, you put some solution on it, and you get a result in 15 minutes. That certainly could be a game changer for us as we manage this disease. And again, our hope is that we will see those supplies continue to increase in the coming months.
The next question is from Community Impact. Will Travis County's COVID-19 vaccine distribution plan line up exactly with the state's? For instance, will APH have some discretion over who receives the vaccine next after people in nursing homes and frontline healthcare workers?
Well, I'll start by saying we're awaiting the state's final guidance on that. It's not clear yet how prescriptive the state's going to be for the phases of the distribution. But again, our hope is that we can cover those high-risk individuals early on, and that includes our priority populations, so our communities of color who are also at higher risk due to underlying condition and lack of access to healthcare and other social determinants of health that will impact their course. But again, we have to wait a little bit longer for those final recommendations from CDC to go to the state and then working with our coalition to make final recommendations for our community.
And to echo what Dr. Escott said, we definitely are trying to make sure that whatever planning we do as far as prioritizing populations, that it is in step with what the Centers for Disease Control Prevention identifies and with the Department of State Health Services. However, the coalition has developed our own localized priority population guidelines that we've provided on our website so that it helps give us additional guidance as to when priority populations are identified for us. How do we then further drill down into how we would identify who we would slate to be the first in line to get those vaccines. Echoing what Dr. Escott says, we're following the data. We're following who has the most severe illness from COVID so that we can better protect everyone involved in our community. So we're working through those different pieces, and our vaccine coalition partners, healthcare partners, but also those that are participating in the vaccine coalition that are representing those groups that are most disproportionately affected are key to informing how we can better meet those needs and mitigate the barriers that they may have to accessing vaccine.
Our next question is from Estonia. Federal CARES Act funding must be spent by the end of the month without a new relief package in place. How will Austin Public Health continue to fund its pandemic services like testing, vaccine distribution, events, and others?
The department alerted City Council and the mayor, as well as the city manager, of what we would need to continue to provide services at the level that we are providing. Within that information that we shared with them, we also talked about what we would need to provide the vaccine to our community. We are going to continue in January our budget office. We're working with our budget office to continue to provide the services that we have at the same level that we have provided them in the past. And so that those dollars will come from our budget office.
And I would just like to add that, you know, the department has also received some funding from the Department of State Health Services to support COVID response efforts. And some of those funding will extend on through March of 2021. And we also have one contract that's focused on the epidemiology response that will extend on through March of 2022.
Our next question is from the Austin American-Statesman. Have Austin Travis County officials attempted to estimate what percentage of local residents ignored guidelines and traveled for the Thanksgiving holiday? If so, can you provide those numbers?
We don't have those numbers. I think we're going to find out those numbers this week based upon the number of cases that we're seeing as an indicator of how much people move. You know, we do have mobility data, which UT Austin, our modeling consortium, utilizes to do the predictive modeling. So that will come into play as we look at the forecasts for cases here in the next couple of weeks.
And I'll just use this time just as a reminder. We put out some information prior to the holiday, just reminding individuals to change their plans and consider the lowest risk will be able to remain at home with individuals in your household. If individuals have decided to travel, we have recommended that when they return to Austin and Travis County, or if they've had Thanksgiving with folks outside of their home in a large gathering, we recommend that they quarantine this week and that they go ahead and schedule a test because our goal is that they're able to take the test and that they remain quarantined until they receive those results back from that provider. And so that is something that we have continued to encourage individuals to do because we were prepared if individuals were to travel. And so we'll continue to do testing and work with our partners in the community as well on testing efforts.
Our next question is from Co-op Radio. And you've answered this a little bit, but I'm going to go ahead and ask it because I think he's just the reporter here is just trying to kind of maybe get just a little bit more detail about the distribution of the vaccine. And the question is, what details has the state shared about those groups to be made part of the second and subsequent rounds of vaccine distribution? Is there any information that you all have garnered yet?
Yeah, I'm happy to chime in. The state has released their criteria for the varying phases of vaccine, noting that they've identified healthcare workers and given some specificity in that realm as looking at long-term care facility workers, those that are treating those in the hospital in ICUs, and that we need to build those redundancies among those critical workforce. As we get into additional phases and we have more vaccine available, they have looked at how do we expand from that, looking at essential workers, that could be frontline staff, and those kind of details are in their criteria that they have launched, and it is available from the Department of State Health Services. So those details we are working to help inform how we would plan for distributing vaccine here at the local level and identifying what that looks like as far as our local population and who those priority populations include.
And I'll just add that, you know, similar to the 2009 H1N1 vaccine when it was released, you know, the situation was very fluid. And so similar to this, you know, we have some information, we understand what our priority populations are, but there may be adjustments that need to occur along the way. So as an example, although healthcare workers are identified in that first tier, one thing that the coalition will need to make hard decisions about based on all of the priority populations is if it trickles out like it did in 2009, there may be, we may need to define what priorities lie within priority populations as well. And I think those are some of the tasks that the Vaccine Coalition is currently working on. Again, we need to stay the course and hold on. We need to be flexible and adaptable in this situation because there's still a lot of unknowns. We have an idea of what's going to happen, but how it trickles out into the community may be another story. So we are trying to anticipate and plan so that we're ready for any type of scenario that may come our way, and so that we can deliver and provide doses of vaccine to our entire community appropriately.
While we've been talking, those CDC guidelines that, Janet, I think you mentioned that were going to be coming out, the changes in the quarantine period, they were released, and KXAN is asking you, since the guidelines say that now individuals who have close contact with an infected person can end their quarantine after 7 days if they receive a negative test, or after 10 days with the test, what is the reaction of Austin Public Health to these changes?
I would say, we've been anticipating that these guidelines are changing, would be changing, and we've heard about them for quite a while now, but we just haven't seen the official release of the information. So, one thing that we're hoping to do is to make sure our case investigators are able to provide that information to people that they reach out to, so that they have the information, and if anybody inquires about it through our hotline or whatnot, they can get the correct information. Again, this is similar to what we said in the very beginning of this disease pandemic, is that as we get more data and as we learn more, we will see that this pandemic will evolve, and there will be changes to guidance the more information we have. And so I think this is just an example of CDC making that adjustment and change. And again, we have anticipated that. Now, I don't know, Dr. Escott, if you want to add anything about the healthcare workers portion.
Yeah, this is one of the changes that we really expected was going to happen. In fact, we anticipated back in, August, September, that we would see this recommendation come out at some stage. This protocol is basically what we've been doing for healthcare workers and first responders for months now. And we know that as you go past a week to 10 days, the chances of developing COVID-19 start to go down dramatically. So by marrying a shortened course of isolation or quarantine with a negative test, it really helps us identify the vast majority of individuals who will eventually develop COVID-19. Is it possible individuals could develop them between 10 days and 14 days? Yes, it's possible, but it starts to get really unlikely the further out that you get from the time of exposure. So again, the strategy is important. The change is important, but it's also important, as Janet pointed out many times today, that folks quarantine when they've been exposed. Not kind of quarantine, but really quarantine. Staying home, isolating themselves, even within their household, from other people. That doesn't mean stay home except go to the grocery store, or stay home except for, go to the drive-through and pick up some fast food. It means you must stay home. And the more we can get people to listen and hear and abide by that message, the better chance we are going to have of decreasing our transmission and entering better stages of our community risk.
One thing I would like to add, though, with that change, as individuals are making an adjustment to that change, that criteria does say that you must monitor your symptoms. And so we don't want individuals to think that, I can just quarantine, stay home. But you also need to determine if you have any level of symptoms, and you should be symptom free during that entire time. And if you're not symptom free, then you definitely need to take a test, before that time has ended, whether it is the 7 days or the 10 days. So I just encourage individuals that if you have any symptoms, and I mean, it can be mild, my throat is sore. I've lost a sense of taste for the food that I'm eating. So it can be very mild, but you need to make sure that you're monitoring any symptoms that you have.
I'll just say one other thing, and that's the importance of testing as soon as the symptoms start is not just for identification of being COVID-19 positive, but also the therapeutics that we have are best suited early in the course of illness, and that includes the monoclonal antibodies. So it's really important that particularly those who have risk for complications, they're older or they have underlying health conditions, that as soon as day one that those symptoms develop, they go out and get tested so that they can both know if they have COVID-19, but also talk to their healthcare provider about the possibility of therapeutics at that stage.
And now this is our last question, and it's from Fox 7. There are many pop-up test tents coming up around town. How can people trust these locations?
That's a great question, and I think it's important for folks to do their research. All of those testing facilities should be affiliated with a medical director and a lab director. So folks need to ask questions about those sorts of things. They need to find out what kind of test is being performed. We still hear cases of pop-up testing sites doing antibody testing, which we know is not a useful test to determine if somebody has COVID-19 now or not. So people need to do their homework. Ultimately, people can reach out, look at our APH resources, schedule a test through us. Obviously, the testing sites that are affiliated with recognized organizations are going to be reliable. That includes Austin Public Health, our hospital systems, Baylor Scott and White, St. David's, Ascension Seton, Austin Regional Clinic, as well as other recognized clinics in our community. If it's a pop-up tent with in a parking lot, you need to ask questions.
And I'll just add that I think that that's one major key is if they're following procedures, I've heard numerous stories about pop-up testing sites being operated out of the back of somebody's trunk of their car, and the operator is wearing a pair of gloves and a mask, and that's about it. Most credible places will be following pretty specific protocols when administering those tests and processing the sample collection. So if it looks a little uncharacteristic, you can certainly call Austin 311 for information, or a hotline, and we can try to field any of those questions. But for the most part, I would say, like Dr. Escott said, do your homework. We have sources listed on our Austin on our City of Austin website as far as legitimate testing locations, and I think the state also has that data available to the public. So I would just make sure that you're aware if the practice seems a little unorthodox, maybe you should refrain from being tested at that location.
Thank you. At this time, panel members, we will have closing remarks, and we'll start with you, Ms. Hayden.
If you have traveled outside of Austin and Travis County for the Thanksgiving holiday, or if you had Thanksgiving with members that don't currently live with you, or you may have decided to go to a get-together after, it's going to be important for you to quarantine in your home and schedule a test. It is so important for you to know your status if you have COVID-19. It is very important for us. That is going to help us to mitigate the spread of the disease. The other reminder is that I understand folks are really getting tired. We do applaud you for your efforts. It has really helped our community when you have pulled together and you have established new traditions. And so wear your mask, watch your distance, make sure you stay home if you're ill, and wash your hands. Thank you.
And I'll add on to that by saying those who are at the highest risk, those who are over the age of 65, those with underlying health conditions, really must stay home. There's widespread community transmission. We're in stage 4, which means that folks in that high-risk category need to only go out if they're doing takeaway or delivery, and better yet, have somebody bring supplies to them if needed. We need to protect our most vulnerable, and if we do so, we can also protect our healthcare infrastructure and prevent unnecessary deaths.
And I'll just tack on to what both Director Hayden and Dr. Escott have said, and that is this next 2 weeks are going to be a critical period of time for the city of Austin and Travis County. And we expect and anticipate that we might have increased number of cases in our community. And so therefore, if you go out, you need to limit your activities out in the community. So if you go shopping, it's not going to be it should not be a big family event. It should be one person. You should do what you can to prevent and limit your disease transmission risks and refrain from participating in high risk activities such as gatherings. So again, as Director Hayden mentioned, you need to make sure that you cover your face with a mask. You need to social distance. You need to avoid crowds and confined spaces. You need to stay home if you're sick. You need to stay home if you've been exposed to somebody and are in a quarantine period. If you are sick, even with mild symptoms, you need to stay home and not go to work or other activities, as Dr. Escott mentioned.
And I'll just round our information out with, we know that vaccine is on the horizon in the coming months. As we reach into 2021 and we start to see more vaccine enter into our community, really, if you're identified as a priority population, consider taking a vaccine. Consider supporting others who are identified as priority populations for taking the vaccine. This is a real solution to help us get out of this pandemic and help protect everyone safely. While that vaccine is continuing to become more and more available, making assurance that folks can get to the vaccine, we'll continue to work on that. But also, we've got to make sure to follow those safety protocols that we have in place so that everyone is protected until we actually flatten the curve and we rid our community of this COVID-19.
That concludes our media availability for today. Thank you to APH Director Stephanie Hayden, Dr. Mark Escott, Chief Epidemiologist Janet Pichette, and our guest today, Cassandra De Leon, Interim APH Assistant Director with Disease Prevention Health Promotion Division, and our pool reporter, Betty Cross from CBS Austin. Thank you for joining us today. Have a safe one.
you could love with the best of them.